OET Listening Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse instructing a patient on how to use a nebulizer. Now read the question.
Good morning, Mr. Johnson. Today I'm going to show you how to use your nebulizer. First, you need to assemble the machine, connect the air compressor to the nebulizer cup using the tubing provided. Then pour the prescribed medication into the nebulizer cup. Make sure the medication is at room temperature before using it. Next, attach the mouthpiece or mask to the nebulizer cup. When you're ready, turn on the compressor. Hold the mouthpiece tightly between your lips or place the mask securely over your nose and mouth. Breathe in slowly and deeply through your mouth until the medication is gone, usually about 10 to 15 minutes. Remember to clean the nebulizer after each use, according to the manufacturer's instructions. Do you have any questions?
Question 26. You will hear 2 doctors discussing the management plan for a patient with chronic obstructive pulmonary disease, COPD. Now read the question.
Hi, Dr. Lee. Do you have a moment to discuss Mr. Andrews' case?
Of course, Dr. Smith. What's the latest update on him?
Well, Mr. Andrews has been experiencing worsening symptoms of COPD. His latest spirometry shows a significant decline in his FEV1. Despite being on a long-acting bronchodilator, he's still having frequent exacerbations. He's been very diligent in taking his medication, and I reviewed his inhaler technique personally, and it's correct.
Given his decline, I think we should consider adding an inhaled corticosteroid to his regimen. It could help reduce the frequency of his exacerbations.
I agree. I was also thinking about referring him for a home oxygen assessment. His oxygen saturation levels have been borderline, and I'm worried about nocturnal desaturation.
Question 27. You hear 2 nurses discussing the care plan for a diabetic patient. Now read the question.
Hi, Nurse Taylor. Can we go over Mr. Brown's care plan? He's been having trouble controlling his blood sugar levels.
Sure, Nurse Jones. What's his current regimen?
He's on metformin and insulin, but his blood glucose levels have been fluctuating a lot.
Have we checked his insulin administration technique and timing?
Yes, and it seems correct. I'm concerned he might not be following his diet properly.
It might help to involve a dietitian to reassess his meal plan. Also, we should ensure he's monitoring his blood sugar levels regularly and keeping a log. We should also educate him on the importance of regular physical activity, as it can help stabilise his blood sugar levels.
That's a good idea. I'll arrange for a dietitian consultation and review his blood sugar log with him.
Question 28. You hear a surgeon and an anaesthesiologist discussing a patient scheduled for surgery. Now read the question.
Hi, Dr. Martinez. I wanted to discuss Mrs. Thompson's case. She's scheduled for a cholecystectomy tomorrow.
Sure, Dr. Wilson. What's her medical history, and does he have any allergies or previous reactions to anesthesia?
She has hypertension and type 2 diabetes, both well controlled, no history of cardiac issues. Her pre-op labs are within normal limits, no known allergies and no adverse reactions to anesthesia in the past.
Great. Have we ensured she's been NPO since midnight?
Yes, she's been fasting as instructed.
Excellent. I'll plan for general anesthesia with careful monitoring of her blood pressure and blood glucose levels.
Thanks, Dr. Martinez. I appreciate it.
No problem, Dr. Wilson.
Question 29. You hear two nurses conducting a handover at the change of shift. Now read the question.
Hi, Nurse Sarah. Ready for the handover?
Yes, Julia. Let's start.
Okay. First, Mrs. Lee in room 102 had her gallbladder surgery yesterday. She's in some pain, but it's managed with morphine every 4 hours. She's also on IV fluids and antibiotics. Her dressings are clean and dry. So far, there are no complications. Just monitor her for signs of infection and ensure she's comfortable.
Will do. Anyone else?
Question 30. You hear a pharmacist advising a patient on how to take a new medication. Now read the question.
Hello, Mr. Davis. I see you've been prescribed metformin for your diabetes. Let me explain how to take it. Metformin is usually taken twice a day with meals. Taking it with food helps reduce the likelihood of stomach upset. It's important to swallow the tablet whole and not to crush or chew it. If you miss a dose, take it as soon as you remember, unless it's almost time for your next dose. In that case, skip the missed dose and continue with your regular schedule. Don't take a double dose to make up for a missed one. Also, be sure to monitor your blood sugar levels regularly and follow your doctor's dietary and exercise recommendations. If you experience any side effects like nausea or diarrhea, let your doctor know. Do you have any questions about taking metformin?
That is the end of Part B.